Story 20, Neurologist here. A healthy patient came in with a few-month history of left-hand numbness. My first thought was carpal tunnel syndrome, but physical exam was not very convincing. I got CT head and found malignant metastatic lesions. Patient and family were talking about expensive designer bags, were very happy. I had to break the news. They went from healthy to potentially a few months to live. Sometimes I hate my job. Edit. I am reading replies of people getting worried about their loved one's symptoms. Remember, cancer is incredibly rare. Everything else is much more likely to be the case. Story 21. I don't know if it counts, but I got bit by a bat and thought I should go get the rabies vaccine right away, and my wife said, "It's expensive, see if you even get sick." And I almost listened to her advice until I looked up what the first symptoms would be to know what to watch for, and everything was pretty unanimous. Once symptoms start, it has a 100% kill rate. And if you get bit, it's non-negotiable. You should go for the vaccine ASAP. Story 22. I'm not a doctor, but I have two. I had a doctor appointment, just a 6-month checkup for my diabetes. My heart rate was up, so my doctor sent me to the ER for blood work. Turns out I was having a weird version of diabetic ketoacidosis where my blood sugar wasn't elevated, anion gap. They kept me in ICU for a week. My mom went to her doctor for shortness of breath. He told her she was old and overweight. We took her to the ER, where they drained a couple of liters of fluid off her lungs. Her breast cancer from 5 years earlier had returned, metastasized, and invaded every bone in her body, her lungs, and her brain. She died 5 weeks later. Story 23. I was the patient. At 36, I hit my tonsils out. I developed an infection and my stitches split, and I started bleeding in the back of my throat. The blood was shooting straight down my throat. It felt like pop rocks. My wife has the neighbor come over to watch the kids, and we go to the nearest ER. I go in and my wife parks the car. I go to the front desk and say my throat is bleeding. They have me sit down and fill out paperwork. My wife comes in and goes full Karen. I get sent to the back and immediately vomit semi-coagulated blood all over. I then look at the nurse, tell her I'm cold, and pass out. I wake up in a hospital room. I had emergency surgery, and they estimated I was down over 2 to 2.5 pints of blood. Apparently a nurse in the ER saw me throw up the blood, and she threw up as well. Story 24. 1 month ago, my husband had his blood checked for low testosterone, prostate cancer survivor. That night we were in ER, and he was diagnosed with stage 4 pancreatic cancer, spots on the liver. No cure. He had his blood checked late June and nothing. No symptoms except for being more tired than usual. Please go to the doctor regularly and get checked out. This couldn't be helped, but many things can. Story 25. As a resident, I had someone come to clinic to resume routine care for routine screenings after an older sibling had passed. Reason for visit/CC. I want to take better care of my health. I noticed they had a little bit of blood on their napkin and asked to examine their mouth. A few missing teeth and a massive mass on their gums. Immediately sent them to ENT, where they learned that it was oral cancer. They'd eventually get the whole enchilada of mandibulectomy, jaw resection, glossectomy, tongue removal, and I think even neck dissection and laryngectomy. I followed them peripherally on a consulting service until they ultimately passed away in the hospital about a year later. The cruel irony of the whole thing is even worse when I wonder if he would have had better quality end of life if I'd never bothered looking, and it had just taken its natural course. Just more reasons to avoid tobacco and alcohol. 80% of oral cancers attributable to their consumption. And eat plants. Story 26. Not a doctor, just answering for myself. Also, I don't really know if it can be considered a serious life or death situation. Had post-concussion syndrome, and already had an MRI done. It was nothing out of the ordinary. Then one day about a month later, I got up and suddenly fainted. Consulted my doctors, and they all agreed it was likely a one-off and I was fine to go travel. But they still thought, to be on the safe side, I should do another MRI scan when I returned. I had a great few weeks traveling, and that included lots of outdoors and sports stuff. Then I came back and went for my scan, this time with contrast. By that point, I honestly felt like I was wasting time and money. So imagine my shock when the results came out, and I was told I had a brain tumor. I later found out that people with the type of brain tumor I am suspected to have tend to have it manifest through seizures. I just happened to have mine in a dead area, so I just never had any symptoms at all. I've since had it taken out, and we're waiting on the histopathology to get back.